if I traded it all, if I
Welcome back, everyone. I'm excited about bringing on my next guest. They've been on with me before. But listen up, everyone. If you're in pain, this is going to be a cool segment for everybody to listen to. I have with me Dr. Laura Markinson, if I said it rightly. Mm-hmm. And then you have with you Dr. Cindy, what's your last name? Hayes. And you're the owner of Mesa Naturopathic. I don't know what's wrong with me today. I'm having time being tempted.
Great.
Tell everybody a little bit about yourself, what you do, and what you did today before you came here. This is awesome.
Hey, Carol. So I'm a naturopath. Dr. Cindy and I are fully licensed family practitioners here in the state of Arizona. And we have a branch of our practice, which is pain injections for arthritis and injury. And before I got here, I played 2 sets of tennis.
Unbelievable. She looks fantastic, too. And wait, tell them your age. You got to talk a little bit about that because,
I am 57 years old.
Wow, amazing.
And about 2 years ago, I didn't think I was going to be able to play tennis again. And fortunately, because of injection therapy in my left knee, which I've had 5 surgeries on, and my lower left L4, L5 facet joint area in my back. I had endoscopic rhizotomy on my left facet joint because I have osteoarthritis is my ailment that I inherited from both my parents. And so I heard about exosomes therapy, and so I went and did that before I even opened up my practice through another company to see if they really worked. Mm-hmm. I'm like, what is this? And I went to one of those dinners and paid a lot of money. And let me tell you, I've had 1 set of injections in my knee and my back, and I'm back to playing tennis, and I feel great. I'm out of pain.
In one little shot?
Yes,
and
1 treatment.
Wow.
Yes.
But I asked you beforehand, and if it's okay, I want to talk about this, because I said, well, is it stem cells? And you said no.
The exosomes are part of the amnio fluid from a donated placenta from a healthy birth, and it has nothing to do with a fetus or anything weird like that. It's part of the fluid, and they extract them and purify them. And everybody can look up at chimera.com, KIMERA.com, and that's the exosomes that I have at my office. And then Dr. Cindy can explain more about how prolotherapy and PRP, and we also have amnio at our office for injection therapy for pain.
Go ahead, doctor.
Okay, so prolotherapy is the lowest level of this kind of therapy. It is actually utilizing natural materials and an anesthetic. It's injected into the area where there's pain, and what it does is it stimulates your body to heal that area, to go back and revisit it and build collagen, tendons and ligaments, and help make the area more stable. And it's very successful. Studies show it's 85 to 95% successful in giving people some improvement. As opposed to, I think we read 52% improvement with back surgery.
Yeah. Wow. Now, we're live on Facebook, so hi to everybody out there. Like us and follow us. You've got some specials, and normally we wouldn't even talk about stuff like this, but, you know, when you go for surgery, obviously, and some of it's not covered either, right? I mean, right. I don't know whether you are some of this is covered by insurance or not.
We would have, if you haven't had imaging done first, we need to find out why you're in pain. Mm-hmm. We need to get to the root of the cause. Is it something that we can correct without even doing any injections? And we need to know if it's a structural issue that actually needs surgery. I had a gentleman come in and he had a shoulder pain, and it turned out that injections working to help repair a 70% rotator cuff tear. Mm-hmm. So it's the afterwards care that we can help bring down that inflammation once they're fully recovered, and get them feeling better with that kind of injury.
Right. Now, if you don't have that kind of an injury, you can actually come in and get that done. Very affordable. I'm looking at these things, and you even offer if somebody gets one, they can get another one at half price. But I want to talk about this too, if that's okay with you. You have that DioWave laser, which is a level 4 laser, and I think it's a great way to have people come in the office and have that consultation with you.
Absolutely.
You offer this for free for everybody.
Their first treatment.
Their first treatment is free, and it's this DioWave laser that, I mean, when I talked a little bit about it, I mean, we had a lot of people that had called in the last time you were on. Tell them a little bit about what it is. It's super. You've done that too. Start with something like that. Take your baby steps, and then if this is right for you, then this would be right for you. Go ahead.
It's another way to reduce inflammation in an aching back or a joint, elbows, knees, ankles, plantar fasciitis. It helps reduce inflammation and heal that. The infrared, what the laser is it's far infrared and infrared, and that light feeds the mitochondria inside the cell, speeds it up, kind of irritating it, but it speeds up the process of removing the inflammation and healing the area. And you can take up to 10 to 12 treatments, but we have packages, and it's a very quick something you can do on your lunch hour, or even after work you can make a later appointment. We'll accommodate people even on Saturday mornings. It's about 10 minutes.
Well, I'll tell you something. They're offering the first one for free. I think it's worth it to get that relief at least one time to try it, right? It's a 10-minute deal. It will just take that much time. They're located in Mesa. You can call them direct. They do free consultations. Their phone number is 480-306-8111. Or you can call in here. I'm going to let everyone get one from me. Okay? It's a 10-minute, what it is, it's a DioWave laser treatment. If you're dealing with pain in any way, you need to call in here and get this. And I don't like to say you need to people, but on this one, I think that people should. Give it a shot, try it, and then you'll see. Maybe you need to take the next step. Maybe you're fine with this. The number here to call to get entered into win, no, we're going to give it to everyone. The number here is 602-277-5369. Toll free, it's 1-866-536-1100. Pain. We wanted to talk about pain today. We are talking about the DioWave right now. The injections that you do. I wanted to ask, because you said that you can get one and then get one for half off, let's say, and they're not expensive. $100, $120, or $200 for one. It's not a lot of money at all, considering when you're in pain, you'll do anything, correct? To make yourself feel better? Well, let's say they have pain in there, like a sciatica that goes down their leg, but they also have neck. Or can they do them in different areas? How does it work?
Yes. Absolutely. Especially the prolotherapy, it's dextrose and lidocaine, and sometimes we add procaine. So these are things that are minimally invasive, and they create that a bit of healing. Cindy needs to talk about this. Dr. Cindy knows more about it than me. I'm fumbling.
That's okay.
Go ahead.
Okay. So it causes a microinflammation, which brings the growth factors that your body has to the area where the dextrose and procaine is injected, and then your body goes to work on healing that area.
Thank you.
Yes.
So the body is, well, the body, this is a thing about the body. It will heal itself.
The body knows how to heal.
It does, but it does need a little help, right?
We're teasing it along and kind of hacking the system is what I like to say, and encouraging healing where it wouldn't happen otherwise, or it would just take a longer time. And we're like, let's get going. We want things right now to be better.
I know. But here's what I love about your office too, is that you have several modalities. I want to say a plethora of modalities, but every one of them are natural in that way, because that's what you are. You're a naturopathic, and she's done everything. You know, it's nothing that she's going to do to you that she hasn't done for herself.
That's why I got into this. I just love this medicine.
And we are going to tell your story. She's also writes an article and a newspaper that is, what is the newspaper here?
It's The Groves.
She writes an article there. We've got our lines open here for everyone to get, and I believe that everyone should give this miss a shot. It takes 10 minutes to do. And when I say I'm not talking about a shot right now. I'm talking about the DioWave laser. I do think it's a great way to start, to come in and try that, get some relief, see where you are with it. They'll take you to the next level if you have to go, and they're going to do it in the natural way. You can call them direct at 480-306-8111 or call here 602-277-5369. Welcome back, everyone. We're talking a little bit about pain here, and I have been talking to the doctors right here at the break about some of the different modalities that are out there. And one of them was that I had said that what's the difference? A lot of people know what a cortisone shot is. They're very painful, from what I remember my dad used to say. I have no idea what they're like now. It's gone now. But what is the difference between the shots that you offer and a cortisone shot?
I'll field this one. A cortisone shot is really beneficial for tendinitis, tendinosis, where there's a lot of inflammation and it's an acute injury that needs that inflammation reduced. That's the job of cortisone. It reduces inflammation and does it pretty quickly. The problem is repeated injections will start to deteriorate the cartilage in the joint. So we don't want to have somebody getting those too often. They're great for that acute injury and to help people get back to work and that, but then let's start working on repairing that area with the prolotherapy and the platelet-rich proteins.
Now, doctor, you're located in Mesa. Your website is Mesa NP for naturopathic.com. You do free consultations with people. You write articles. You have a blog on you're all about education.
Correct.
And you know, the last time you came on, you were excited about coming on and be able to really help people understand, you know, some of the different modalities that naturopathic medicine is used for and what you do in your office. The last time you were on, we did it's called the DioWave laser, and it's unbelievable. It's a level 4 laser that you use, and a lot of people were interested in it because it takes 10 minutes. You're offering it for free for everybody to try, and the number to call here is 602-277-5369. Toll free, it's 1-866-536-1100. Call in here and get entered in to win that. I mean, like we said before, we're going to give it to everybody. We just said, you know what, let's everybody have it, because it's something that I think everyone should start with that. It's a great way to start, and then find out. You'll have that consultation. You also wanted to talk a little bit about people and having their not their X-rays, but their MRIs done and things like that.
Correct. We'll, if appropriate, we'll read your reports and send you to an orthopedic if it's if you need surgery or an opinion, for sure. We're the guide to help you go where you need to go, and also order your imaging and put it through insurance. And then we'll discuss your options. You know, it's nice to spend some time with a doctor, half an hour, and just talk about, okay, these are my options for my pain.
How many people can do that? You go into a doctor's office, they do not do that. They are in and out. You're in and out. They hardly can talk to you. And, you know, it's what I loved about you the last time you were here. Boy, do you really work one-on-one with your patients. I really saw that. You had a patient that was here that, as you were coming in here, had to go to ICU. You were on the phone. You were helping them get into it because you knew how important it was important. Oh, I'm sorry, the emergency room, because they were having something like an appendicitis or something like that, and you wanted them in there. That's how you work that closely with your patients. That's amazing. Not everybody does that. Call in here and start off with this, I think, is a great way. And so many people are out there. They're living with pain. They don't have to. Right. You said that you had pain and that you've done all of these. Now, one of the ones that you wanted to talk about was the PRP and the amnio. Go ahead.
So I'm going to move this back over to Dr. Cindy.
Now, these are shots, but they're not, they don't hurt, and even one of them, just one shot, can give you complete relief.
Let me explain. Dr. Cindy Hayes is an expert at doing joint and pain injections. I will do the consults, and then I send them over to her. She does the consults for the injections. I can do Prolo, but I'm not the injector at my office.
You
it's
have a
Dr.
professional that
That's
does
right.
that part of
She's
it.
the extra training, and she's very good.
So let's talk about them, doctor. When you so when you put in a cortisone shot, man, they got to go in there and move it and everything, and it hurts a lot. How about these? What's the difference?
Oh, what the difference is it's something that's going to cause a microinflammation, right? And it's allowing your body to heal itself. We would always I like to start with prolotherapy, which is the injection with the dextrose and the procaine. The next step up from that is PRP, and PRP is platelet-rich plasma. It's derived from your own blood. We would draw your blood and spin it down and pull out the platelet-rich plasma and inject that along with the prolotherapy solution into the area where there's pain. The PRP is beneficial because it has growth factors in it, and it helps. It's like getting a double treatment. You get the Prolo that brings your platelets and growth factors to the area along with the PRP that has it in it already. So it's like getting a double effect.
She's so excited about it. It's amazing. I love watching your talk. You are passionate about what you do.
Yes, because people are getting great results. I think that I have not had anyone that's had the shot that hasn't had some improvement.
That's awesome.
Yes.
Okay, and so we've got everyone that's going to get this. Well, we're going to start you off with the DioWave laser. It's a level 4 laser. And again, this show is for everybody. Maybe it's you that you're listening to this going, you know what, I really should try that. Maybe it's someone that you know. That's what networking's all about. Tell them about it. You're getting it for free. Our number here, 602-277-5369. Toll free, it's 1-866-536-1100. The first treatment is for free. You go in there, it's 10 minutes, and you will see some sort of improvement right away with that. Then they can start to talk to you, have that consultation, and how does that, usually what happens once they start doing that? Do they start to do a little bit of everything?
We're so individualized. It's what the patient wants to try. I wouldn't blame if they just wanted to come and try several goes at the several treatments with the 10 minutes with the laser. But if it's more complicated and we know that there is destruction in the joint, like there's cartilage and arthritis issues in the joint, then we will give them their options.
What about the sciatic nerve? Because that's not necessarily in the joint, that's in the nerve. I hear a lot of people have that. A lot of people do. What would you suggest for them, for that sort of a thing?
So the piriformis lies on top of the sciatic nerve. It's a long muscle in the gluteal area that can be so tight that it can be not strangulating, but pushing on the sciatic and causing pain. The discs can be pressing and causing sciatic secondary pain. So we need to know and get a good diagnosis of what's causing the sciatic pain to begin with. And then is it sending him to my favorite chiropractor in Mesa? Or is it, we got to get imaging. Do they have imaging? Dr. Cindy does shiatsu and stretching.
So there's all different
we do
things.
Acupuncture.
You don't just jump into doing a shot. You do all sorts of things before that.
Correct.
Mm-hmm.
We want to get you out of pain, and we don't want to, cost a lot of money. We want to give you options. The main goal of our practice is to help the patient get better and get on their way.
Well, you call yourself the makeover doctor.
That's right.
And it's really about making over yourself to be able to live your life the way you really should be living it. You shouldn't be in pain. There's no reason for it.
That's why I wanted to brand myself as the wellness makeover doctor. Is there so many people out there that are being dragged down by the medical system and depressed because they're being told they have all these awful things wrong with them, and they may be sitting at home and thinking, well, I don't know how to get better, and all my doctor did was give me a prescription. So if you come see me, I'll review your prescriptions, I'll review your lifestyle and your diet, and let's see how things can get better in a fun way. It's not white coat and stuffy office. We have a good time. You come in, have a cup of coffee or tea, and let's visit and talk about your health.
Wow.
And get you feeling better.
Isn't that neat? They're located in Mesa. Their website is Mesa NP for Naturopath. So mesanp.com. You can call them direct. They do free consultations, little 15-minute consultations. Go into the office, have a cup of coffee, sit down and talk to your doctor and tell them a little bit about what's going on with you. Their number direct It's 480-306-8111. We've got our lines open here, and I'm going to let everybody keep on calling for the next 5 or 10 minutes. Our number here, 602-277-5369. Toll free, it's 1-866-536-1100. Call in here. Get this DioWave laser for, for treatment. It's awesome. Start with that. Have a cup of coffee, and for 10 minutes, you'll feel better.
There you go. Let's get you on your way.
Give us a call here, 602-277-5369. Some of the other things that you might want to talk about today, real quickly, you have a couple of minutes.
Oh, golly, I just did a wonderful platelet-rich fibrin PRF facial yesterday.
For somebody.
For acne scars. And I'm really excited that this nice young lady came in and we performed that. And it's relaxing and it's fun. It's a fun side of our practice where we get to play and
make
do
people
facials
feel
and feel better, take care of scarring.
There's so many people that have scarring, and especially from acne. Oh my gosh, so many people. They have a plethora of modalities that they do at the Wellness Makeover Doctor. That's what she is. We've got our lines open here for everyone to get, and everyone's going to get it. 10 minutes just to go ahead and make yourself feel better. Our number here, 602-277-5369. Toll free, it's 1-866-536-1100. This is the DioWave laser. It's a level 4 laser that you're going to try out with that. We're going to take you to the next level if you have to, just by calling here, 602-277-5369. Check them out on their website. It's mesanp.com.
You should be mine.